My name is Dr. David Kendler, and I'm from Vancouver, Canada. I'm serving as the co-chair of the ASBMR Congress Highlights program this year. The American Society for Bone and Mineral Research 40th annual meeting was held in Denver, Colorado, September 8 to 11, 2017. In the accompanying slide deck, you'll find summaries of some of the key abstracts and symposia presented at this meeting. There were a number of key themes at this year's meeting. Basic and translational science presentations included information on animal models of cellular senescence and the potential role of senescent cells in promoting aging of tissue. Novel therapies may provide inroads in dealing with chronic disease associated with aging, such as osteoporosis. Other basic presentations updated us on the potential role of the microbiota in bone loss. There were several presentations on novel analyses from DEXA scans. From the Manitoba database, DXA-derived estimates of finite element analysis bone strength gave additional fracture predictive ability beyond DXA and FRAX alone. Other novel analyses included three-dimensional modeling from DXA scans, providing information on cortical and trabecular bone compartments and changes on therapy. We saw a number of presentations on anabolic therapies for bone, which will help us to position these therapies for the most effective management of osteoporosis patients. The VERO study randomized postmenopausal women with vertebral fractures to weekly oral risedronate or daily subcutaneous teriparatide for 2 years. We saw data from predefined subgroups indicating equivalent superior anti-fracture efficacy in patients randomized to teriparatide who were previously on bisphosphonate or who were treatment naive. We saw analyses of the FRAME study of romosozumab versus placebo for 1 year, followed by a year of denosumab in all patients. The anti-fracture efficacy of 1 year of romosozumab appeared to provide a foundation effect with persistent anti-fracture effects during the 2nd year when therapy was denosumab for all patients. The long-awaited results of the ARCH study of romosozumab sclerostin antibody were presented. Postmenopausal women with vertebral fractures randomized to romosozumab for 1 year versus alendronate with follow-on therapy on alendronate for all patients saw vertebral and non-vertebral fracture efficacy, which persisted long-term as compared to patients treated only with alendronate. An adverse cerebrovascular and cardiovascular signal in patients on romosozumab needs further evaluation. There was a further presentation from the FREEDOM study indicating progressive decreases in vertebral fracture risk as patients continued longer term on denosumab therapy out to 10 years. We saw longer-term favorable data on hypophosphatasia patients treated with aspartase alpha. In another presentation, we saw that patients with hypophosphatemic rickets treated with an FGF23 antibody had persisting radiographic improvements after about 1 year on therapy. There were many interesting plenary lectures and symposia, including a debate regarding the potential anti-fracture efficacy of early treatment of postmenopausal women with anti-resorptive therapy. A symposium presented interesting updates on the interactions between muscle and bone. Overall, the 2017 ASBMR meeting was filled with exciting science. Researchers took advantage of the opportunities to interact directly with their colleagues from around the world. I hope you will enjoy the summary slide deck which we have created to bring to you some of the highlights of the meeting.